Morning.
Hi, Matthan.
Hi. So, welcome everyone, and joining us today on the Mend is Dr. Geoffrey Kimanje from Chelsea Arcade Medical. Now, you're a UK trained GP who's earned his membership at the Royal College of General Practitioners in 2023 and then moved to Australia. Dr. Geoffrey provides all care across all areas of general practice, but with some special interest in skin cancer medicine with early melanoma detection, and you do a bit of travel medicine as well. Is that right?
Yeah.
Well, welcome, Dr. Geoffrey.
Thank you, Matthan.
How's your day been so far?
I'm not too bad. Nice to meet you and everyone. And so hoping to provide some information today.
Yeah, we're really excited to have you on board. And I mean, this is your second day now with us at the clinic, which is great. It's been great to have you.
Thank you.
Now, today on the Mend, I would like to talk to you a little bit about men's health.
Sure.
Now, we know that there's a lot of things out there about women's health, lots of different types of appointments you can book and checkups and tests. But I feel like we don't really talk a lot about what's available for men these days and what is men's health and kind of what does that include from your perspective?
My friend, that's a fair question. So, men's health, the way I would describe it, it sort of covers the general well-being of men, which includes their mental health, the routine well-being in terms of illnesses and things like that, and spans across all lifespans of men, including young people as well as elderly, and it includes so many different factors, musculoskeletal, cardiovascular, skin cancer screening, and depending on the risk factors of patients, really.
I guess things like mental health and I guess it's not necessarily something that's specific to men, but it is something that needs to be spoken about and raised. And
absolutely, that's really relevant because it sort of comes along with so many other things, integrates along with so many other conditions as well. So I think it's very relevant.
So I guess from your experience, what do you think men find the hardest to discuss in consultations?
So I guess I would go back to your point in terms of mental health. This is one of the things men find very difficult to bring up, I guess due to a lot of factors in society that present men to appear strong, self-reliant, and you do find that sometimes bringing that up creates a picture of weakness, and which is not actually true. But I guess mental health would be the most difficult thing they try to bring up in consultations.
As well. With mental health, like I said, it's not just specifically for men. It affects everyone in any form and shape. But for men specifically, what are I guess some men specific checkups and health checks that we can get as men that can help us improve our health, or just ensure that we're living a healthy life?
Okay, fair enough. So that's a very general question, but if I would narrow it down to particular things, I would say first of all, the things we will talk about would be those that cause a lot of health issues in men, because statistics show in Australia men live 4 to 5 years shorter compared to women, and most of the reasons why that happens is that these things are preventable if they did present earlier. And these include, ideal routine blood pressure check, cancer screening, especially for men over 45. And there's this bowel screening program.
That's very important.
And then the skin checks, because that's part of cancer screening as well. I would say it sort of depending on occupational exposure. And then other thing I would put about mental health is very important. So I would say it varies depending on the age of men. So for younger men, ideally a blood pressure check once a year, then cancer skin check depending on the occupational exposure. Then as men grow older, depending on risk factors, you think about maybe routine blood tests to look for cholesterol, blood pressure, and again, attend your cancer screenings, because you do find those factors intertwined to cause those preventable illnesses that cause early death in men.
And I guess it can even come down from family history and things that are hereditary and passed down as well.
I agree, because those risk factors, family history, hereditary, sort of raise the threshold on when to investigate a patient. So depending on that, you can be able to decide what particular investigations the patient needs. and give them the right care that they deserve.
Yeah. So, I mean, like you touched on blood pressure and cardiovascular health,
Yeah.
and I guess even diabetes and, those kinds of things.
Yeah.
They're all somewhat hereditary and they can be passed down, but is something like mental health, can something like that also be passed down?
I wouldn't say be passed down. If you put it as passed down, it seems like it's hereditary, which is not correct. What
Okay.
I'd say, maybe there's risk factors that could make people have poor mental health outcomes in the family. If, for example, the parents are already struggling, you do find they don't have adequate care to take care of the children, who end up getting that trauma if they don't taken care of. So that's the way I would put it. So if, like we always say, if you don't take care of yourself, you can't take care of others.
Of course,
so
yeah.
you do find that if someone is struggling and they can't out 100% give their best to their children, who end up getting affected, that's more like a risk factor rather than a hereditary problem.
It's like a domino effect,
Yeah,
right?
that's
Like
correct,
if you
yeah.
can't look after yourself and you're not setting an example of that, how are your kids going to look at that as well? I guess, we spoke about, briefly outside of this, just how our parents were. Like my dad might be a particular way, and he wasn't always open to going and getting checks done, and he was very reluctant to go to the doctors, and I'd always go with, like, my mum would take us through, but my dad would not really go and get his checks. Now he's a lot more involved, as he's understanding that now that he's a bit older and he's seeing his kids grow, and I guess our lives expanding, where we're each getting our own families, and I guess he's now realizing he wants to be more a part of that, and he's now really thinking about, oh, you know what, I should go make sure I get my my blood sugar check and my blood pressure and my cardiovascular, because there is a little bit of that in our family in terms of
Fair enough.
from his side. So yeah, I'm seeing that now from him, and I'm hoping I can encompass that and then pass that down to my children to see that I also look after my health, and these are ways that you can do it.
Absolutely, I agree. And this is why things like this, the podcast, the more information people have, the more they're empowered to make decisions, good decisions in terms of their health. So I guess, like your dad, because there's more insight into problems, there's more information out there, they are looking at things differently because of experience. So they tend to be more proactive in seeking help.
Yeah. But I guess, how with my father, it's almost like he's doing it out of a reactional standpoint. Like, it's like, oh, now I can feel things are happening. Now I need to go do something. But, I'm trying to do it a different way and be preventative and try and manage it earlier on, so that when I get to that point, I'm not having to react to something that's happening in my body.
Yeah, 100%. Because like you said earlier, what general checks can men do, like we talked about, depending on the risk factors, depending on the age, if people are able to attend those simple things, those routine checks, you do find that most preventable illnesses are picked up earlier, and you're able to prevent them from progressing or keep them under control, which gives people ability to live longer than expected. So I would really push for that kind of advice. Yeah.
So you mentioned bowel cancer screening check and like prostate checks and stuff. Is that only generally, like, do you only do that when you get to 50 or 55, or is it something that men should do younger at an earlier stage, or is there just not much?
So mentioning that, I meant basically the National Bowel Cancer Screening Program. So we tend to say when people get over 50, every 2 years they get a bowel screening, because we do find the risk factors for illnesses increase as people get older.
Of course.
Having said that, it doesn't mean that if people are younger, they shouldn't get health checks, because we've seen these things happen in very young people. Which tends to be unusual, but it happens. It
happens, yeah.
So it doesn't exclude that if you're young, you don't get these investigations. Basic advice: if you're worried about something, see a doctor. If things have changed and you have that insight, that instinct that tells you, oh, there's something not quite right. It's always good to get an opinion from a doctor,
Of course.
rather than just letting things be and they end up causing problems in the future.
Yeah, and even just coming at a basic blood test or something,
Exactly.
check your hormones, your testosterone, and just basic tests to just see that everything is functioning like it should.
Yeah, absolutely. So if you discuss with your doctor, they'll be able to assess the risk, what tests are needed, and they're able to give you the best advice. Yeah, to get the right
of
help.
course.
Yeah.
Now, as we spoke about mental health a little bit earlier, I just want to touch on that a little bit more. And I guess from your experience, what are some signs that men might be struggling with their mental health that, they may not come and speak to you about it, but what are things you can notice that might bring that to your attention?
So it's a good one. Like we talked earlier, so men tend to present as strong in society, so which kind of creates a barrier in a way. So you do find that sometimes they present very differently compared to what we call textbook depression. So some of the signs would be someone presents with withdrawal from things they would normally enjoy, what we call anhedonia, insomnia, whereby they have poor sleep, they have difficulty maintaining relationships, irritability or anger. So they do have those signs to initially to start with, low mood, so you tend to pick up those cues like that, and then you do find that someone's actually struggling with their mental health. You're able to make a diagnosis from those things if you explore more, and you're able to give them the right help.
Yeah, signs of like repetitive behavior and like, like addictions to things. And
substance abuse.
Substance abuse, things like
because like alcohol misuse.
Alcohol's a big one. There's a part of it that's culture, but then it can push past the culture.
Yeah, it's a very good, people think it sort of gives you a short break towards what's happening around you, and detrimentally it can cause bigger problems because of that small euphoric effect people get from it.
Yeah. So, I mean, I guess touching on that, like, if someone wanted to improve their health in just a few changes, where can they start?
Very good. So, always say simple steps make the biggest differences. You don't have to do something really very fancy or massive. Simple things like looking at the risk factors, for example, weight. Weight loss is very important. Eating healthy, making sure that are you exercising daily. There's always a recommendation about 150 minutes per week of some intense exercises. You don't have to do everything all together, but you spread it out throughout the week. It tends to be very good. And you do find that when you lose weight, most of your risk factors for even simple things like, not simple things, the difficult conditions like cancer, diabetes go down depending on the percentage of weight that you've lost. So these small changes can make such huge differences in people's lives, and you don't even end up needing medications for certain things.
So I mean, someone like myself, I work in an office and I may not be physically active, so I need to allocate time to ensure that I'm getting my activity per week. But what about someone that is quite laboursome for their work, someone that's working in trades or is a builder or working as a labourer in a warehouse at a factory? Does that kind of work and physical activity still count as physical activity towards benefiting your health, or is that different?
I'd say it's still physical activity in a way, but it's not cardiovascularly beneficial, if I put it that way, if it's not focused. Because you could still work physically and then you still have bad lifestyle activities, or you could still work physically and all you do is maybe lift or bend or that kind of thing, but it doesn't really work your heart, if I put it that way. So it has to be focused exercises. That's really help. Some intense exercises that make you sweat, that you feel like your heart is going, and focus that you have goals depending on what you're doing. If you're doing physical labor, your goal is to finish that job. But if you're doing things like exercise we've talked about, your goal is to make your body better. So there has to be a goal to the kind of exercise you're doing. So I would say in some way it might not really count because the goal is different.
I guess someone that might be struggling with high blood pressure or some kind of cardiovascular issue, generally doing labor and laboursome work, especially if you're lifting things above your head and doing things like that, it's not always going to be good for you.
I don't think so, because it is very nuanced, I would put it that way. So I wouldn't recommend that if you're a physical job, then that should be okay, because I've seen patients who still do physical jobs and they're still overweight. And they're still end up developing these illnesses because of so many other different factors. So it varies a lot.
Of course. And I mean, I'm sure there's so much more that you can expand on in broad, it's such a broad topic, because it encompasses all parts of health, right? Like men's health. It's just make sure you're looking after yourself as a whole and eating well. It also includes social health. So make sure you're spending time with the right people, spending time with people and not just isolating yourself, and being with your family, eating good, and all that is just going to bring about a healthier lifestyle.
It's a comprehensive thing altogether. It's not just one factor.
So even if part of men's health is if you're having a relationship issue with someone you're living with, a parent or a wife or children or whatever it might be, even just talking about that can bring about beneficial changes.
Yes, because family sometimes encourages you. It's very important. It's good for society as well. You need that sort of push sometimes to do things, and that can make a difference. So yeah, I agree 100%.
Yeah, of course. No, that's great, Dr. Geoffrey, and I think we're going to have to get you back on to kind of touch on some of these topics in a little bit more detail. But I want to thank you for joining us today on The Mend, and thank you, listeners, for tuning in. And with that, hope you all stay well, and until next time, keep on the mend.